Hello guys, welcome to the Delivery Room podcast. The mic is on.
The room is sacred.
Let's talk.
Hi guys, welcome back for another episode. Today we are so excited. We are not on our own today. We've got a very special guest with us. We've got a pillar in the Black women community.
Yes.
We've got a CEO, we've got a fellow podcaster, and we've got a Black mum. Most importantly, we would like to introduce yours to Audrey.
Thank you, girlies. That was such a good intro. Thank you. I like the pillar thing. Yes, pillar. Yes. Clock it. Yes.
So, Audrey, how are you today?
I'm really well, actually. Yeah, I've had a very pleasant morning, a very smooth journey getting in here. So yeah, can't complain.
Good. Well, thank you again for coming.
No,
We'd
thanks
love
for having
to have
me.
you here.
Thanks for having me.
Do you want to just tell us a little bit about yourself, what you do?
Yeah, absolutely. So my name's Audrey. I am a podcaster. I'm one half of the Receipts podcast. And this year I also launched my mummy platform that I do with my friend Aisha. It's called Raising Me and Mine. And that recently developed into a podcast as well. And then I've got my other side show that I do called The Recap. And I basically talk about reality TV shows because I'm obsessed and I love reality TV. So we just unpack that. So basically I'm a professional like yapper. I just talk all the time.
Yeah, honestly.
That's all
there
I
needs
do.
to be a degree
No,
presented.
100%.
Because I say it all the
100%.
time.
I just chat. I'm a mum. I've got a 2-year-old daughter, and I'm married. My husband's name's Nicholas, and yeah, that's about it. Really, that's me in a nutshell. Yeah.
So obviously we invited you on this pod. We invited you onto Delivery Room because we're trying to basically like create a platform for Black mums to come and tell their story, especially because we know the statistics are out there.
Yes.
We are not just creating this platform to kind of, create that sort of, because I feel like sometimes it's a dark aura around, Black maternity. And we know with the statistics that are out there, sometimes it can create that energy. However, we wanted to create this platform to then bring positivity as well and just give Black mums out there hope that, when they walk into those where they give birth and they are pregnant, that the main thing is that, is not death, that they can actually enjoy pregnancy. You obviously know there's some bits of pregnancy that are not so enjoyable. However, we want to make a very positive impact and just, make sure that our mums are watching this and are informed, feel safe. And
I love that.
So we just, as you said, we know that you are a mum to a 2-year-old. Talk us through your pregnancy a little bit. How was it for you?
Ciao. I don't want to bring darkness to the positivity because I know this is a positive space and I love that. No, my pregnancy wasn't great. I have been quite transparent about it. It wasn't great. I suffered from HG, so I had that, and I can never say it properly because it's such a long word to say, but basically HG is extreme vomiting and nausea throughout the pregnancy, and I basically had it from 6 weeks till the day I gave birth. I was still puking up. And it was quite debilitating, I can't lie. You can't really eat, your sense of smell, my sense of smell was so heightened. I just felt so sick and nauseous. And I just remember everyone being like, oh, second trimester will be better, and then I remember on the day that I hit second trimester, I was like, yeah, this isn't going away. This is still
y'all lied to me.
Yeah, exactly. And it was awful. And then I had really bad what'd you call it? No, oh my God, what's
Heartburn.
Heartburn, that's the one. I had awful heartburn. It was so bad. I tried to just take Gaviscon, but then it was just, that wasn't working for me. Yeah, it wasn't doing anything. So I ended up being put on medication for that. And between the heartburn and the nausea and then just the general sort of woes of pregnancy, it was a lot. I remember I had really bad dental issues as well. I had, oh God, it was a lot, plus the tiredness and all of that. So it wasn't great, So by the time it was time for me to give birth, I was ready. I was I don't care. Everyone's like, aren't you scared? I was like, no, get me in there now. I'm ready. Run the pain. Because I feel like pain is obviously not a nice feeling, but I feel like I deal with pain better than all of the other stuff that I was dealing with. So I was ready for it. But yeah, the pregnancy, I mean, I had some good days. There was a couple of days in my second trimester actually where I woke up feeling really re-energized and feeling really good. And I remember that day I was like, I'm going central. I don't care. And I got on the train and I went to West End, and that was the first time I started buying stuff for the baby as well. I just felt really good that day. I didn't feel as sick. I had waves of the nausea or whatever, but it wasn't that bad. And I ended up in hospital a couple of times because I just couldn't stop vomiting. There was one day about I vomited so much. I burst the blood vessels in both my eyes. So I've got this picture of my eyes just completely red and bloodshot. And it didn't hurt, so I didn't even know. And my husband was like, what's going on with your eyes? And I was like, what? And I looked in the mirror and I was like, whoa, like it was so scary. But it was just literally from all of the tension of just like vomiting so much. And it weren't nice. It weren't nice.
No. I mean, hyperemesis is...
Yeah, I think we say it all the time. Like, it's when we see women that come in with it in hospital, you feel so helpless at the same time, because it's like, we can give you all the fluids and we can give you all the medication, but we know when you go home, it's gonna start all over again, quite essentially. So you said you had a few hospital visits. How did you find that? Like, how did you find coming into hospital in terms of how you were looked after? Do you think that they did the best that they can do, essentially?
Yeah, I think they did. I think they did. Like you guys were saying, there's very little that they can do when it comes to HG. So all they could do is just make you comfortable. I was put on a drip because I was so dehydrated. So I was put on the drip, and I was there. That felt like forever on that drip, like waiting for all of the fluids to like go into my body. So that felt, but I don't remember that experience being negative. I feel like if it was, I would remember, and I would have like made a mental note of it. I don't remember it being bad. I just remember just feeling really tired and just really over it. So I don't know if I just wasn't computing my surroundings because I was so like focused on what I was going through and feeling like crap. So yeah, but I don't remember it being like particularly negative.
Okay, well that's good. At least that's a positive
100%.
Side to it. And I know you kind of had the hyperemesis quite severely throughout, and I know you said there was some days you felt a bit better, some days you, well, not so much. In your hospital admissions, were you there overnight, or was it kind of like a come in, take your fluids and go?
Yeah, no, it was come and take my fluids. I wasn't like admitted overnight or anything like that. But there was the one day, the first time that I went in and I was put on the drip, that was really late at night. So I guess you could say I was kind of there overnight, but not in a bed or exactly. Okay, but no, it wasn't to that extreme.
Hyperemesis, I wouldn't wish it on anyone. It's one of those things where we can't do much.
There's nothing you can't do anything.
Everyone always like tries to say, morning sickness, but no, hyperemesis and morning sickness are two completely different things. And you do hear a lot of the time that by the time you reach your second trimester, you'll be fine. But no, some women like you actually go for it the whole time.
Exactly.
The whole time. So that must have been really daunting. Oh my God.
I'm just a very sick person anyway. Like nausea is like the worst thing. And I remember I tried everything. So when the nausea started and it was really extreme, I tried the patches, I tried the wristband, I tried the mints, I was drinking ginger everything. I might as well have been eating ginger jollof rice. You know what I mean? Like I literally had ginger everything. Nothing was really like cutting through. Nothing really worked. And I just basically just had to firm it. And I know it is really, it is a really hard thing to deal with. Like if I'm on a boat, I'm probably going to get seasick. So I'm quite a nauseous person anyway. So I expected that I would have the morning sickness on 10, which I did. But when I finally gave birth, oh my God, I was just like, I had to just accept that this is going to be something that goes away when I give birth. So
and did it go pretty much straight away after you gave birth, or did
it did. I still felt sick, but that might have been a mental thing. Do you know what I mean?
Sometimes,
I feel like that was in my head. Because I had that horrible taste you have in your mouth as well when you're pregnant, and it tastes kind of like metal. And it was awful, and that was really annoying as well, because I felt like that would trigger the sickness, because that taste just made me feel sick. And so all of that there was just a lot going on in my mouth, man. That was a hot mess. And then so I remember when I gave birth, that was one of the things I was looking forward to going the most, because I was like, oh my God, I just want to eat this sushi. I want to eat this food. Do you know what I mean? And then like that taste didn't leave for at least another 2 weeks. I still had that taste in my mouth for a while. But it wasn't as bad because I didn't have the sickness anymore. So I feel like the sickness went away maybe a day or two after. I didn't feel nauseous anymore.
Pretty much straight away.
So that kind of sums up your pregnancy, I'll say. So let's talk about your labour and birth. So I know that obviously you said that was something you were looking forward to. Did you have any plans? Like, did you make a birth plan? Did you know exactly like where you wanted to give birth, how you wanted pain relief wise?
So we made the plan to do it in the birthing suite. I was never someone that was against epidural. I was just like I'm not going to pretend, not that people are pretending, but I didn't have any like aversions to it.
Yeah.
Do you know what I mean? Like, I didn't have any like really intense, strong feelings about not having it. I was just like, to me, it's something that's available, and, you know, I trust in the healthcare system that it's going to be administered properly.
Yeah.
And if it's something that's going to relieve the pain, like if the pain, like for me, it was all very much dependent on how bad the pain was. And obviously this is my first child, so I didn't know what to expect in terms of the pain levels. I've always had really, really bad periods my whole life. So my mum kind of said, oh, you know, give it like labour pains and contractions feel like the worst period you've ever had. And I've always had really bad ones. And so she wasn't far off, but she also was, because ow, you know, ow. And so I was like, well, yeah, like if I can manage it and I don't need it, then cool. But if we need it, have that on standby, you know? So that was in my birthing plan as well. And yeah, like I just planned to have a natural delivery if I could. Again, if I needed to go and do that C-section, it would have, you know, that would have been the case, but that wasn't, you know. And so yeah, so that was the plan, in the birthing suite and with epidural if needs be, and gas and air, you know, just the usual. I mean,
sounds, you were very open. Sounds like you're very open. And I always say that's the best way to kind of go about it. Like, you have your plan, but be open to all your other options. That way, if it has to go a certain way, you're not heartbroken or like upset about it. So that's really good.
Yeah, I probably wasn't like hell bent on doing it a particular way. I really wasn't. I was just like, whatever is best and whatever's going to get her out quickly and safely, you know?
I think a lot of people, especially with the epidural, like to associate having an epidural with like failure or like, I failed, or a sign of like weakness. But I reiterate all the time, it doesn't mean that there is no prize. You do not come out with a prize or a crown for anyone that does this with no pain relief. The pain relief is there. If you need it, you use it. And we do find that people that do often come in with the absolutely closed-minded just go the complete opposite way to actually what they plan to do. So I always say, keep an open mind, because the way labour and birth can just go left and right, no matter what plan you have in your head. We always say, you can have any plan, but your baby and your body is going to decide exactly how you deliver. So when you come in, please have an open mind, because if you close your mind, when other things start to divert in different directions, it's going to come as a shock. Shock leads to anxiety. Anxiety leads to your body just closing up, hormones not working, and there you go, you've gone the other way.
Yeah,
absolutely.
True. And I also relate to cultural stuff, like because many of us I'm Ghanaian, my parents, like, they did it with no epidurals, the aunties. So I think it's like, well, I had 6 kids without an epidural, so you can do it, you don't need it. So I think that fear as well is embedded in some women from early. So they're like, I mean, how many times do you see women come in and they're like, I have to do it. Or even when they decide they want it and they've got like their mums with them and their mum's like, no, she can't have it. And quite literally they're scared, and you can see it, but you can't really say anything. So it's all the cultural practices that kind of scare women. But having an open mind is the best thing you can do in pregnancy, labour, birth. But what about your delivery? How did that go?
Oh my god, I think my birthing story was funny from what I can remember of it. The delivery, because I did have the epidural, and I remember I was in agony, like the contractions. Period. Yeah, that was not true. It was so much worse than what I expected. The pain was unbearable. And I remember when I'd gotten to the hospital and I had to wait for a bed, like for hours. So basically, actually, let me run it back. I had preeclampsia, and I didn't know that I had preeclampsia till I went into labour. And so what had happened was my hands and feet were really swollen. And then I was starting to have like pain in my lower back, and it felt like, okay, this feels like it could be contractions kind of thing. So I called my mum. My mum is also a midwife, and she flew down from wherever the hell she was, and she just came to me. And then my hands were really, really swollen, and I just felt like I was in so much pain. I was like, there's no way I'm not like 8 centimeters dilated. Like, I'm ready. And then I got to the hospital, and she was like, oh, like, you're like 0.5. And I was so embarrassed. I was like, oh my God. But my mum had said, you know, her hands and feet are really swollen. Like, can you just, you know, check her urine for preeclampsia? And she kind of said, well, you know, no, it's not. It's just a normal symptom of pregnancy. But my mum was like, I don't think so. Please, I'd feel a lot more comfortable if you tested her urine. So they tested my urine, and lo and behold, I had preeclampsia. And so obviously with preeclampsia, as you ladies know, you have to be admitted straight away.
Yeah.
So I was admitted straight away, but then I had to wait for like 5 hours for a bed. So I was just like in one of those
the bays,
with the curtain,
you can hear everyone.
just hooked up to the machine. I was just waiting, and so so there was that. So then by the time I finally got a bed and I got to the birthing suite, I was like, oh, this is luxurious, honey. I was like, the room was so big and spacious. There was a shower. I was like, why do people complain about like NHS? This is lit, kind of thing. So yeah, I was in a lot of pain. I had the epidural because I needed it. And yeah, so then after the epidural hit, I think it was maybe like another 5 or 6 hours before I was finally ready to push.
Okay.
But the epidural, like that, oh my gosh, I just felt nothing. Like for me, I felt nothing. I just felt, I couldn't even feel my legs. Like I just felt like nothing from the waist down kind of thing. So when it was time for me to push, in my mind, I was fighting for my life. And then they were just like, girl, we're gonna need some more. Like we're gonna need more from you, hon. Like, and I'm just like, I'm so confused. I'm really going in. Like at least I thought I was anyway. So I was pushing for time. Honestly, my whole delivery, I think it took about 3 hours to get her out. And halfway through, because she was edging in and out, her head coming in and out. And so then I think about an hour and a half into it, they were like, we need to take a break. You need to take a break. And so I took a break. I can't remember how long for. So many of the details are a bit foggy, but I took a break and then we continued pushing. And then I was just really struggling. Like I was really, because I just couldn't feel anything and it was really hard for me without the sensation. And then I just remember I had like a couple of like midwife, like auntie ones, and they were just like, go on, girl. They were, because the doctor started saying to me, look, the baby's going to be in distress. If you don't push her out, we're going to have to take you down to theatre for a C-section. And again, I wasn't necessarily opposed to a C-section, but it didn't feel like it was all the way necessary. And I just
got all the way to that point.
Exactly. I'd gotten like, you know, so close. And I remember my husband was there and he was like, go on, babe, like you can do it. And my mum was there and they were telling me to fight. And I was just like, and I also think I was paranoid that I was going to poo. And they could sense that, and I think the midwives could sense it, and they were like, if you poo yourself, it doesn't matter, we see it all the time, just push and fight for your life. And so I went and I was going, and then eventually she came out. But yeah, the midwife was going, go on, girl, don't let them take you to theatre, man. Go, you can do it, go, girl.
That sounds like me. That sounds like me. You don't want them to do it. And that's what I'm like, listen.
Yeah.
Don't let them take you to theatre.
Yeah, that's what she was telling me. She was like, you can do it, girl. She was like, go on, you can do it. And so yeah, that did actually help me, you know, that did encourage me. And then eventually we got, actually that's a lie, that's not true. I did struggle a little bit. They had to use the clamp.
Oh, okay.
Yeah.
The forceps.
The forceps, that's the one. So they had to use the forceps on her and just, and they pulled her
Did
out.
they do that in the room then?
They did that in the room.
That means you was very close. Because usually we sometimes take you to theatre to use the forceps and so on. That's when we're like, oh, we're not sure if baby's gonna come. So if they could do it confidently in the room, that means they were like, okay, you were really
exactly. It was definitely in the room. So then she came out and I was like, thank God. Oh my God.
Sounds like, did you get the epidural from early on then? Or?
Yeah, I did pretty early on. Yeah, as soon as I got a bed, I was like, this is unbearable. I was like, I actually cannot. Yeah. And then then I had to wait for the guy, and it felt like he was like skipping along, setting it up. I was like, I was like, speed it up, man. I was like, let's go.
Did they check you before they gave you the epidural?
What do you mean check?
Like, see how dilated you were from?
Yeah, they were. They did. And I think I was like 3 centimeters or something dilated. Yeah. And then after I had that, I definitely napped for time. I slept. I was so worn out. I was tired. And then I woke up, and then by the time I woke up, it was like a couple of hours before they were like, okay, you're like 9 centimeters now. I think we're going to be ready soon. Yeah.
That sounds like a quick labour.
Yeah, that sounds quite quick.
Quite straightforward as well.
Yeah, it was straightforward, I think.
And that's the good thing about epidural. It's actually underrated. Epidural, that's what I always say, like, especially when I see them like worn out, I'm like, look, this epidural will give you time to rest, will give you time to close your eyes a little bit. Like, you need that. And sometimes you just need that recharge to really go ahead, because sometimes when you have been so worn out for the labour, sometimes women do get to the push and stage and they just got absolutely nothing left. Yeah. And sometimes that epidural can just give you that time to like rest, and then you're like, okay, cool, I'm ready to push
again. Yeah,
exactly. That's really good.
Exactly. Yeah.
Okay. So in terms of preeclampsia, I just wanted to ask, did you have any other symptoms apart from the swelling of the hands? Like, was your blood pressure okay?
Yeah, I think the what made my mum want to check was my hands and feet. Other than that, I don't think I did, because I just had like what is the final check you have? Is it like 38 weeks or 39 weeks?
Yeah, sort of
like 37 weeks.
Yeah,
I had my check not long before, and there was no sign of any protein in my urine. So at the time when my last checkup with my midwife was, I was absolutely fine. And so I don't know at what stage I developed it, but I just know that when I'd gone into labour, that's when they found it. And so for me it was just the hands and feet. I didn't really know what to look out for, to be honest with you. So thank God I had my mum there, because she was able to like spot some signs and force them to test me. So
did they give you any medications for it, or was your blood pressure high or anything?
Yeah, I think they gave me like medication, but I just remember they were trying to give me painkillers and I just kept on puking it up because I still was suffering really badly from the vomiting, and so I just couldn't keep it down. And so so I remember that, but I don't remember if they gave me anything for the preeclampsia. Honestly, I can't remember.
I guess sometimes with preeclampsia, when it's hard, if you don't have like high blood pressure, it's like we're not gonna just give you blood pressure. It's kind of like a wait and see. I feel like sort of like a seesaw type of condition, because it's like, if nothing's really happening, it's like all hands off. But then when something's happening, it's like, all hands on. And that's the difficult thing about preeclampsia though, is that, you know, like, I don't know, like, let's say your mum wasn't a midwife and they were like, okay, like, you know, the swelling's absolutely fine, and then God forbid down the line things actually got worse. That's the thing with preeclampsia, and it can actually like worsen very quickly, which is why obviously it's very important that everyone does actually know the signs. Like, it should be embedded, because I would think, I mean, we're not community like midwives, we work inside the hospital, but I'd like to think that the community midwives are actually embedding that in everyone's head to know actually like what are the signs and symptoms, because it's that borderline to normal. Like, swelling, okay, is normal in pregnancy, but there's like a borderline between like it actually being preeclampsia and just normal swelling.
So a few things that I guess people can look out for is dizziness, blurred visions, swollen hands and feet like you had. I think loads of people mistaken it for just the normal pregnancy, but I think sometimes when it's overly swollen, and if like you're sitting down and elevating your leg and it's not reducing, then that's something to like be worried for. So blurred vision, headaches, like really bad headaches, swollen hands and feet. These are things that everyone can kind of recognize at home, and then escalate to your health professionals, your midwives out there, and then get them to do your blood pressures and test your urine for protein and all these things. So just something for people to just keep like a mental note of.
Because they were trying to send me home. So just going back to what you were saying, she was like, oh no, it's fine, it's just a normal symptom, go home and come back later. So like you were saying, it could have been, God forbid, fatal had I gone home and I, you know, 100%. Had the condition. So just thank God.
100%. How was it having your mum as a midwife? Like, was she like more midwife mode with you?
I was gonna say, I was having your mum.
Was it like, was she on midwife mode, or did she shut off and like go into mum mode?
No, do you know what was so funny? Seeing my mum be professional. Like, and she would basically switch between the two. So she's a Ghanaian mum. She's very like, you know, in my business all the time, whatever. But then like the funniest thing is that when I was, because she would come to me with like, come with me to some of my scans and stuff, and she was gagging to let them know she was a midwife, but she wouldn't tell them straight away. So she would just start using all these random medical terms, and the doctor would be like,
how do you know?
And she'll just say all of these terms, and it was just, but she'll throw it in there so casually, and then they'll be like, oh, do you work in the healthcare field? And she'll be like, oh yeah, like as if she didn't make it obvious. What gave it away? You know, so she was doing all of that. So it was really interesting to see her in like her, you know, in her bag essentially, like doing what she knows and what she loves and stuff. But no, it was actually fine. It was good. I feel like no matter how like annoying my mum can be or whatever, I consider it to be a blessing that I had 100%. Someone that does this day in day out and has been doing it for years, so she knows what she's talking about, and so, you know, she could really like speak up for me and advocate for me. But she was cool. I was pleasantly surprised. I genuinely thought my mum would be a bit more annoying, but she was fine.
That's good. She was good, because it's always a thing where, are they gonna be, you know how mums can be, super mums, overbearing, or are they gonna kind of take a step back and just encourage
that one is
you
not an option. Like the stepping back thing,
I can imagine it being reassuring as well, knowing that if they didn't pick anything up, your mum was on job, on their case.
100%.
And sometimes as well, when people come with someone that is a midwife, I think because they know that, they're more attentive on it, because they know if they miss something and God forbid you miss something, your mom picks it up. That's a whole new
Exactly.
thing. So I always tend to think, especially when they have like, how many times when you have someone comes
you have someone that knows what they're talking about, you kind of sharpen up a little bit.
It's like Ofsted's in the room or something.
Yeah, you're like, we can't get anything wrong. But
Yeah,
that must have been difficult for her, because I remember when I was my god sister's birth partner, and I walked in, I was like, look, don't tell anyone I'm a midwife. Look, I'm just walking in, and I just walked in, I was like, and then I would hear the monitor, and every time I'd hear like the baby's heartbeat, I'd be like,
hard to hold back.
And I was doing it, and my godsister could see that I was like fighting for my life. Something, and she's like, oh, she's a midwife, by the way. And I was like, why did you tell her? I shouldn't have told her.
Yeah.
But the midwife was really nice. Like, we kind of worked together. Like, she let me look at the trace, and she was like, oh, look, like, this is what's happening. Proper gave me like a proper like handover, what we call like the handover proper. And I was like, oh, okay. But I was like, well, I'm not trying to step on anyone's toes. If it was me, you know, sometimes when it's like you're at work and someone's like, ugh, and you're like, can I just do my job?
Yeah.
So I was just like, well, let me try and like.
And I guess because you're young as well, it's probably even more unassuming as well. So you can kind of just like.
Exactly.
Yeah.
And when you get how old are you? And you're like,
oh, do you guys get that?
Yes. How old are you? How old are you? I know, like, I get that all the time.
Really?
How old are you? Got any kids? How old are you?
oh, I was like,
Yeah.
what happened to this?
Literally. I always follow her. I'll be like, 25, but I've been doing this for
just know I'm qualified.
I'm just like,
just know I'm qualified.
Like,
yeah.
I can
Don't worry,
do
you wouldn't just be hanging around in the
yeah.
hospital without a qualification.
Right.
Do you know what I mean?
But also, I think some people tend to relate if you have children. They can relate to you. They know. Because I guess we don't have kids. So me telling you, like, breathe and do this, I think when they know you haven't been through it, they're looking at you like, what do you know?
You don't even know what you're talking about. You
So,
never felt this pain before.
sometimes after all of that encouragement, they're like, have you got any children? And I'm like, no, sorry.
So can't help you.
Sorry.
Yeah.
But yeah, no. Okay, how do you find motherhood? I mean, you've got quite a few things on your plate. You've got a podcast already. You've just started another one. You talk about the recap, so you do that. So how do you balance that and being a mother?
I love being a mum. It's my favourite version of myself. You know, I did it a bit later. I mean, I'm 39 now. So I had Anaya at 38. I had her, got pregnant at 37. And it's been like absolutely, like, I've loved it. And I was really ready. I really was ready. Like, she was very much planned to the day, you know, like we were really just like, okay, let's get the show on the road kind of thing. So of course, when I found out I was pregnant and her, you know, coming into the world, I've loved it. I've really embraced it. Like I really enjoy it. And I probably used to be like, oh, you know, I'm not going to be one of those people that carries their kid on their head and always going on about it. But it does kind of change you when you're in it in real. Like, I think it's easier to say it in, you know, in hindsight, but in reality it's like, no, do you know what, I just have to accept this version of myself and that I'm in this space and I love it. Like, she makes me laugh every single day. It's like I said, it's my favorite version of myself. Like, I really love me as a mum. Like, I think that it's tested my patience so much. It's made me be creative. It's made me, you know, I don't know. There's been so many good things that have come off the back of it. And in terms of juggling, I'm really fortunate because of what I do. I kind of just like choose my own hours, and so if I have to, obviously I always have to prioritize her, but I just organize my day to make everything fit in. My husband's great. I've got a really good village. Like, my mum is very much hands-on, which she should be, because she basically was on my neck about having she's been on my neck about having a baby for the last 10 years. So now that she's here, I don't want to hear no excuses. And she's really good, to be honest. Like, my mum has really like lived up to all the pressure that she put on me, like in a good way, in a fun, playful way. So she comes, and on the days that Tolly and I record, which is a Wednesday, my mum comes every Wednesday and she has Anaya all day. And then, and when I've got to do my other bits, my husband's there, and we, you know, he works for himself. So we're very flexible with our schedules. And so because of what I do, I'm able to do so much stuff from home, apart from the days that I'm in the studio. So I consider myself to be like a full-time mum, full-time stay-at-home mum. And then she's in nursery 2 days a week now. So she started nursery, I want to say like 2-3 months ago. 3 months she's been in nursery. So those 2 days also give me time to do more things. And I just try to be really organised on top of everything. So I'm balancing it.
I love that. But I hate when people use the term like, oh, late in life. I just feel like whenever you have a baby, and I think people underestimate how ready you have to be to have a baby.
Your whole life changes.
Your whole life changes. And I think that, you know, sometimes obviously life happens. Some people have unplanned pregnancies. It happens at the end of the day. But you do feel that consequence when you aren't ready. And especially like who you're having the baby with. You know, I say that to my friends all the time. I say, guys, if you guys are even thinking about having a baby with one any rubbish boy, don't even think about it, because I'm telling you, you're gonna live the consequences. You will live it. I think whenever you're ready is whenever you're ready, and I feel like it's so much better to be ready than not to be ready. Because I don't know, some people think a baby is just a toy that you can just hand off and hand off, but honey, it's something that is sticking with you forever, for the rest of your life. And not just even the baby part, having the baby alone, the pregnancy alone, just like what you went through, for example, with hyperemesis, that you need support, you need people that can back you and be behind you. And sometimes people go through those things alone. And it shouldn't be happening. I just say, guys, when you're having baby, please pick wisely, because pregnancy, labor, birth, postpartum, motherhood, it's not easy.
No, and I think pregnancy can be isolating in its own. I mean, I feel like we can all say, be there for you, we can all say these things, but it's you doing it, you're by yourself almost. So if you have no external kind of village to reach out to, I think it can really add to it and kind of make it worse. Like definitely. You've seen so many times where women are by themselves and you can just see in their faces, like it's just a lot on them, and it's very daunting. Feel how terrified they are when you see women doing it on their own. So I had a question actually. Apart from the hyperemesis and the late diagnosis of a preeclampsia, is there anything else you kind of went through medically with your pregnancy?
Yeah, I mean,
and postpartum actually.
And postpartum. I mean, the hair loss, but I feel like that's like a common thing that happens to all mums. But I proper thought I got away with it, because she was like 3 months old, and I was like, why is everyone always talking about you lose your edges? Like, whatever, my edges are full and flourishing, honey. Until one day I woke up and they were like on my pillow, and I just looked on my bed and I just looked at my head and I was like, I ain't got no edges. I was like, my edges are gone. So that was that was quite daunting. So I was like, oh my God, what the hell, my crown and glory. So that was daunting, but I felt better in that sense. I had a lot of friends who had babies around the same time, and so they'd spoken about it, so I just knew it was just like a thing that comes with it. I had a lot of dental issues. I had really, really bad toothaches, and like, it was really, really bad. And I don't know if that's why you get free dental care when you're pregnant. But I was like, I was like, one of the good things they better run that free dental care, because I felt like I was in the dentist quite often. I had really, 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 really bad toothaches and like really bad like gum disease and stuff. So I put that down to pregnancy, because I'd never suffered like that before. I don't know. I just felt very uncomfortable sometimes. Like the sleep thing was really hard. I couldn't sleep because the heartburn was so unbearable. Like it would sometimes feel like, I don't even know, it just felt like a rush of something all the way up to my throat. And like, it was awful. Like the heartburn was really, really, really uncomfortable. Like so uncomfortable. So I would say those things. Yeah.
Heartburn is the worst, and I'm not pregnant, so I can only imagine when you're pregnant. It was
so bad. It was like on 10. It was so bad.
And people, I know it is the case for some people say, oh, because your baby has loads of hair, but that's not
I feel like that's an urban legend.
No, it's not always the case. It's really not always the case. What about your postpartum? Like, how would you say postpartum was for you?
I think it was smooth, you know. Like I would always say, like I consider myself really lucky to not have had any of those issues. Like I felt like as soon as she was born, I bonded straight away. Like I got that wave of love as soon as she was born. I didn't have any issues with her like feeding, or the sleep thing was hard. I thought people exaggerated that. They did not. The sleep thing was crazy. So I was tired and all the rest of it, but postpartum was good for me. Like I didn't have any major issues outside of just being really, really tired. And again, really fortunate. Like my mum came and stayed with me for like 2 weeks and just really helped out. And she was like doing everything to the point where I was getting annoyed. I was like, it's my baby. I want to do something. I was like, I want to do stuff. Now I would give anything. I beg my mum. I'm like, please come and stay with me for 2 weeks. Like, I would give anything to have my mum come live with me for 2 weeks. But yeah, no, it was good. I think when I gave birth So after I gave birth and everything was fine, I spent the night in the birthing suite. I was like, why does everyone go on about the hospital? Like, this is lit. And then they moved me to the labour ward.
So do you know what I do? Yeah, I always, I break it down that they're going to the ward so softly.
Yeah, I wish someone told me.
You know, you see them looking so comfortable.
I was comfortable.
I'm just like, okay, you know, someone's like, go in, and I'm like, okay. So yeah, you're going to the ward.
Yeah, that's what happened to me, and I was like, had my suitcase, I was laid out. I had a shower. I was like, no, this is the life. I was like, I can't believe, like, you know, this is lit. Like, I love it. And then they came and told me, and they told me quite soon. So I was there for so I had Anaya first thing in the morning. So she was born at like 5 a.m. Then I remember I slept, I woke up, I showered. And then like 20 minutes later, someone came in and told me I've got to move. And I was like, move where? I had no idea. I didn't know what to expect. So they're like, oh, you're going to go to the labour wards. And I was like, oh, okay. Thinking it was going to be maybe a minimised version of what I had. Yeah. And it really was not. No. And I was just like, okay. And then obviously you're there with all the other mums and the crying babies and stuff like that. So that was funny because I was so comfortable in my room, in the delivery room. But yeah, other than that, I was really, really fortunate, and I always say it. Like I don't think I had any emotional. One thing that I did feel after I gave birth, was I remember the hours going by, and I was like, oh my God, she's getting so big already. And like, she was like 3 hours old.
They do actually change. No, they actually do change quite quickly, you know, from when they come out to like when you see them on the ward sometimes, or if you see that baby the next day, there are actually slight changes that do happen. They come out all when they open their eyes and they see like the features that come out, they're stretched out.
I was like, oh my God, this is going too fast. I don't like it. Now she's 2, and I'm just like, I actually cannot even believe how fast it's gone. And people used to say that to me all the time, and I used to be like, oh, whatever, man, you're exaggerating. They were not exaggerating, because I remember feeling that in the hospital. I was like, oh my God, she's 8 hours old already. Like, oh my God, time is just flying. Yeah, but
well, it's good that you had a good postpartum experience, not the postnatal ward.
Yeah, that was the ghetto, honey.
I can't lie. Like me myself, even as a midwife, I'd literally be like, guys, get me in a room. Like,
that was the ghetto.
I'm not doing this. Did you need much help, like on the postnatal? But I'm guessing you had your mum with you.
Yeah, my mum was there, and so I needed help feeding. Actually, like I didn't know how to breastfeed. I genuinely thought you hold them and then they just start sucking.
And as do many people. Everyone thinks that.
I had no idea about the process of latching. Like I didn't know that. Like it had to be at a certain angle when they had to. I had no idea, and my mum had to physically hold my breast into position to help me for her to latch.
Yeah.
And I was just like, oh, okay, I didn't know that this would be. And sometimes I did get a bit emotional actually with that, because I really wanted to like, and I did breastfeed and I got it in the end, but I felt a bit like, I don't know, I felt a bit insecure about the fact that my mum had to help me every single time. And I was like, and it made me panicky, because I'm like, oh my God, my mum's not going to be there all the time. I need to learn how to let her latch and, you know, figure it out. So that was quite difficult. But yeah, that was probably the hardest thing, the feeding thing.
Yeah.
And then later on, a few weeks into it, Anaya, she had really bad constipation. And that was so hard. Like that was very stressful for us, because I didn't know anything about that. And she started teething really early as well, which I had no idea. I thought they got teeth. Like I didn't know anything about being a mum, by the way, like literally nothing. So I was very much learning on the job. But the constipation thing, and then she also developed like baby eczema and baby acne at around 6 weeks. And that was very stressful. Well. Yeah, very stressful. And I just remember her skin was getting progressively worse. At first, it was just a bit red. And as the days went on, it got progressively worse. And trying to get help for that was so hard. And I would just call everybody. We went to A&E a few times and no one was able to help. Eventually, I got sent to a hospital, and it wasn't even my local hospital. It was just where they had an appointment available. And thank God the doctor was so helpful. And he was like, okay, this is what it is. This is the medication. And it worked. And it didn't return and hasn't returned since. So those times were quite trying and quite testing. Yeah.
I mean, going back to the feeding, I think everyone would agree. Feeding is difficult.
Yeah.
It's not
but I
easy.
think it's the most underrated thing, I would say. Like, I think...
in terms of what's difficult.
Yeah. And I think everyone thinks like you do. You just put the baby there and you just feed.
Yeah.
Because
Just
really
get
and truly,
it.
when you think about it without knowing the Lord, you think, how hard
Yeah.
can it be?
Yeah.
You put
Just
the-
gotta put
you-
your-
In the
then,
films, they're
there
just
you
like,
go.
and then the
Yeah.
baby just
Movies
starts
are
sucking.
liars.
But I was just
Movies
like,
be lying about everything.
Movies are lying.
Movies.
But yeah, I did tend to see most women struggle with feeding. And when your milk is coming through, your hormones are all over the place.
Yeah.
So it's normal to be obviously emotional, feel
Yeah.
emotional within that time. But breastfeeding is hard. Like, it's hard. And I
Difficult.
always say, like, you're learning, the baby's learning, like everyone's learning here. So I always say, like, give yourself grace. Like,
Yeah.
you will get there. Like, after a week or two, you feel like you've been doing it forever.
Oh, 100%.
And then you just pick it up. But those first like 5-6 days, they're hard.
Yeah.
But yeah.
and I didn't know that about the breast milk as well. And I didn't know about that because collecting that colostrum, is it colostrum?
Colostrum, yeah.
I was like, ain't nobody tell me about this. I just thought you had the baby and the milk was just there
Yeah,
and readily available.
yeah.
And I was like, what do you mean I've got to collect colostrum? Like that is long. And I remember I had to put it in that little syringe thing and feed her through that. And she was quite a hungry baby. And so like it just wasn't cutting it. So she would have that and then so she's been mixed fed since she was born. So she was on breast and formula straight away because she was just greedy.
Yeah, I think sometimes when you do have a hungry baby as well, makes it difficult.
Yeah.
You're trying to get them on.
Yeah.
They're hungry, they're frustrated.
And babies are not
as well.
patient.
No, not at all. She was like, you better get me my milk.
Yeah,
Yeah.
that's the thing. I think we need to do a little bit better in terms of like the information that we put out,
Definitely,
about,
regarding
especially
feeding.
about breastfeeding as well, because a lot of people just think, okay, as soon as my milk's there, but no one actually like knows, like barely anyone knows that it's actually the colostrum that comes first. Like we have so many mums, they're like, oh, I'm breastfeeding, but no, I just gave a baby bottle because I had no milk, and I'm like, you're not meant to have milk.
Yeah,
You're
yeah,
not
yeah,
meant to
yeah.
have
You're
milk.
not gonna
Yeah,
have
no,
milk.
you don't need to have
Until
milk
day 3 and
until day 3
5
to day 5. Then it will.
And
start
I did not
coming
know that.
in.
I
Yeah,
did
a
not.
lot
I
of people
proper thought I
don't.
was like ready to go like a cow. You know, I had no idea about that. So yeah, that
Did
was
you take
massive.
any antenatal classes?
I did. I took it, ironically, the breastfeeding one.
Clearly
the
to
feeding
show that
one.
we need to
I
do
was
the
about to
math.
say.
No, but to be fair, I did it on Zoom. And I was like doing 1,000 things at the same
That's what I
time.
was
Like
gonna say,
I
when
wasn't
it's online,
really,
it's
yeah.
hard
So
to-
it was also I have to take some accountability for that in the sense like I wasn't really. I was just like I'll figure it out. Like is what it is. But it is important to do those things because the information is there if you go looking for it, especially
Definitely.
before.
But I think,
know.
like we need to actually work hard. And remember what we've spoken about how like the breastfeeding rates in like African and Caribbean countries are high. So I think a lot of people just assume, and sometimes as well, when you have your parents that have done it so easily, you just think, oh, I'll get it. Even if my mom said, I'll just get it. But it's like, no, actually, you won't get it because you actually need to learn. And it's just perseverance. That's what you need. You just need to keep going before you get back up. That's all you need to do.
Yeah.
It's not going to be a smooth ride.
I think
Exactly.
that is perseverance is pregnancy, labor, birth.
Yeah, all of it.
everything.
Yeah.
It all takes a lot of that.
It
But
does.
yeah, seeing that through. So yeah, how I was gonna say. So obviously we've spoken about how you're finding motherhood, and is there anything you're looking forward to? Would you consider kind of doing it again?
Yeah, I really want to. Like at first, because the pregnancy was so like not enjoyable for me, and I was just convinced. I was like, I'm not doing this again. Like I just feel I can't put my body through that. It was so exhausting, and like I'm one and done. And I was proper like trying to stand on business. As time was going on, I do definitely want to do it again, God willing. And yeah, I mean, it's something that I see myself having 2 kids, but I'm not having more than that though. But I just feel like I am getting older, and not that there's any limitations on that because people, you know, but for me personally, I feel like 2 would be great because that is what I feel like I can be an amazing mother to 2 for me personally. So yeah, God willing, if it happens again, then I would absolutely embrace it and all the rest of it. But
If it happens again,
if it happens again,
midwives,
exactly.
Well, if it gives you any encouragement, the labour will be much quicker.
Yeah, that's what I always hear.
That one I can guarantee you that. The second one,
I just feel like
shoots out.
That's the thing. I just feel like by virtue of knowing what to expect, it's going to make it so much more
Yeah,
different.
yeah,
So
yeah,
now that I
yeah.
feel like, now that I've accepted I actually do want to have another one, and I've changed and I've done a complete like 180 from saying one and done and never again. Like, even if I had the exact same pregnancy, it's not going to be as bad because I just know what to expect. I've done it before. God willing, it's a better experience. But you know, I'm ready for anything.
And I guess you always think I've done it before, I have to do it again.
Exactly.
But I love how you said, like, you know what you can handle as well. So I think that's very, very important as well.
You have to be honest with ourselves.
Yeah, you have to be honest with ourselves and actually know like what you can handle. Makes your life easier and it makes your baby's lives easier as well. So absolutely love that.
Right. Well, and then, do you have any questions for us? Ooh, I guess maternity related.
Yeah. What are they? I saw, I don't know how true this is, something about apparently there will be some sort of medication for HG. Something's in the pipeline. And what would you say? Because I've got a friend who's pregnant and she's dealing with really bad morning sickness. And I actually can't remember many of the things I tried apart from like the ginger and the patches. Like, what advice would you have for anybody that's dealing with really bad sickness? And what do you think if there is anything is on the horizon for HG?
In terms of if there is anything, I don't think there's anything confirmed. Not that I know of anyways, or it hasn't been brought to the trust that I work at. I think we go for our usual medications that we give and the fluids to anti-sickness to help. But I haven't heard of any talks about any confirmed products that are coming out actually to help.
I think whenever they speak about like products coming out, they're very vague with it. And until they do so much research, they do so much testing.
It can be like 10 years before it comes out.
It can be like 10 years and things like that. So we don't actually sort of hand out information. Well, technically, we're not even allowed to sort of like hand out any information until it's like there's a proper policy in place, like on like NICE guidelines or NMC or any test, anything, NHS official website. And then we're like, okay, this. But then those things take years. They take years of testing. There's so many things that they're doing, like tests right now, even in terms of like large babies, induction. Like there's so much that they're doing right now. But in terms of like sickness, morning sickness, it's so difficult to suggest one thing. Because the severity of it for everyone as well is so different. We would always say like definitely attend the hospital to get your fluid and to get rehydrated again, because when you're dehydrated that can lead to way more issues as well. So we always say whenever you feel like, look, no, I've vomited, absolutely, I need to come into the hospital, come for treatment. There's people that stay in, I know it's not like the best thing, but stay in days on days for that type of treatment until they actually feel better. And sometimes that's what you need, just because even when you do lose fluid, sometimes it can increase stuff like your sodium levels, and that can actually lead to like seizuring and things like that. So for you to be hydrated in the pregnancy is actually very important. So I would always say come in for your fluids. Some people use omeprazole as well.
Yeah, I was on that.
Some people use omeprazole and then just the genuine like cyclizine, metoclopramide, all the antiemetics, to be honest. But everything IV wise always works better because it goes into your bloodstream straight away. Sometimes the tablets aren't as effective,
especially if you're throwing up as well.
That was hard when I was so nauseous.
Just have it IV wise as well. But
in terms of home remedies, I don't know if they work because I have obviously not used it myself, but I always hear people say anything minty should help. So like I've heard people say, oh no, they've got morning sickness, and like the old midwives will be like, try having mint tea first thing in the morning. The ginger, I've heard a lot about the ginger as well to help. So in terms of home remedies, I think that's all I know. I don't know any, but we don't really suggest them these days. So maybe she can try that and see. But I feel like if you look online, there will be a million things, whether they work or not.
There's so many hacks on TikTok and stuff. You just got to try everything so long as it's not too invasive.
TikTok, that thing there.
Hyperemesis gravidum is definitely like, I do think that is something that needs to be in the forefront of maternity research, because there isn't a lot that we can actually offer to women, which is actually not great. Like there's other things like preeclampsia, diabetes, we can be like, all right, cool, take this. This medication will deal with it. This medication will help. This will bring your sugar levels down and things like that. But when it comes to hyperemesis, it's like,
We hit a
okay,
wall.
let's just try everything and
We
let's
hit
see
a
what works
wall.
for you.
Yeah,
I mean,
yeah.
it's very, very difficult.
Oh yeah, I've got a
not
funny
easy at
story
all.
about the diabetes. So you know you have the glucose
Test.
testing.
Yes.
So when they said, "Oh, come on an empty stomach," I thought they were just exaggerating. Yeah. So I went and had my test, and they tell you, well, they specifically told me, don't eat a single thing. Come on a completely empty stomach.
Yeah.
But I'm a pregnant woman, so I had a little fruit bar on my way there. Didn't think it would, make a difference. So then obviously they tested me and you have to drink that horrible glucose
Yeah.
thing. Oh, yuck. So then the next day I got my results and they basically told me that I had gestational diabetes?
Yes.
And I was like, oh, okay, not amazing, but I understand that it's just one of those things. It's kind of just, it's not your fault. It's just a pregnancy thing. Cool. So then they were like, okay, we need to start you on the process of potentially getting you on medication and all the rest of it. And then I was like, oh man. So then I told my mum, I just happened to tell my mum that I had it. And I told her, I was like, oh, well, she was like, did you go on an empty stomach? And I was like, well, yeah, but I mean, I had a little fruit bar. And my mum was like, no.
I know your mum went like this.
My mum
when
was
she
like,
had that.
no. She was like, that can impact the results quite significantly.
Yeah.
So she was like,
Especially
she was like, if I were you, so not only was it fruit, it was sugar.
Yeah.
It was like syrup. There was
Yeah,
all sorts of
all
sugar,
sorts.
all
That's the
sorts of
worst
things
thing you could
fused
have
into
had.
one. So my mum was like, you better call them now and tell them that you did that. So I was like, okay, it's probably not going to make a difference. So I called the nurse, whoever it was I spoke to, and I told her. She was like, oh. She was like, okay, well, that would impact your results quite significantly. You're going to have to retest. Serves me right, I had to go drink the glucose again, innit? So I had to retest again, and then I didn't have it.
There you go.
God, thank God you told your
So
mum
I was
that.
like, oh
You'd have to be
my
pricking
God.
yourself
And
how
my
many
mum was-
times a day for no
Exactly, for no
reason.
reason. And my mum was like, you silly girl. I was like, I know, that was dumb.
No.
That was dumb.
You chose
but-
the wrong thing to
Exactly.
eat as well.
Exactly.
It
Not
had
even-
it all
not even
in.
nuts.
Oh,
Not even nuts or cheese, like a whole fruit
Nothing.
bar.
You had it all in there.
Because, well, yeah, just this small thing.
Yeah.
You literally handed them GDM
Exactly.
on the plate.
Yeah,
There you go.
You gave them your
Diabetes.
diagnosis and said,
I
there you
was
go,
so
diagnose
hungry.
me.
I was like, I can't do this. I'm a pregnant woman. Like, I'm starving. I need to eat a little something.
Yeah.
But yeah.
Also, we need to work on the timings for that because
Yeah.
when I was in clinic and we're booking these, some of these are like 1 p.m. I'm thinking,
How you having a
even
lazy
me
Yeah.
sometimes I'm like, how you having a pregnant lady wait till
Exactly.
1 p.m. to do a blood test and then
Yeah.
afterwards, no, like we
And
need to first thing in the morning. They need to
Yeah,
work
and I
on
was
that.
lucky. I had a first thing in the morning appointment. My appointment was
Yeah.
at 8:20 or something. I was,
Okay, so
I
you
was,
were
I was one of the
good.
lucky ones, and I still flopped.
Got there in the end.
Yeah.
Exactly, thank
Oh,
God.
no, good thing your
Yeah.
mum gave you that warning because I know she literally went, oh my God.
Yeah, she
Yeah.
definitely was like, what? So yeah, thank God for her. Because I would just
That makes me wonder how many people do we
you-
diagnose
yeah,
that have
probably
had something
missed
and
yeah,
don't
and don't say
anything.
exactly.
Yeah.
It's only because
That's
my mum makes.
crazy.
I wouldn't have gone back and said anything.
No.
I would have never.
Because you kind of
You know,
accepted
I
it,
just
like,
accepted
oh,
the
yeah.
results. Yeah.
That's so interesting. How many people probably
Yeah, that's
have a
nice,
little
yeah.
nibble and
Exactly,
then
a little
like,
You think
something.
it's harmless and then they think, oh, well, yeah, like, got GDM.
Exactly.
Yeah.
crazy. Wow. Okay.
That's a great story, actually.
Yeah, it's a
Please,
little-
women, learn from
little
this.
funny
Do not
story.
go and eat a fruit bar before you're GD.
Do not go on the empty stomach like what they told you. Listen
Like
to the
they
people that know what they're
tell
doing. Yeah.
Any more for us?
I've got What is like? Have you got any funny ward stories?
Oh God, millions! Oh my days, so many. I feel like, there's so much. Like we have like funny, like in terms of partners. Then we have like funny. Let me try and think of my. Funny.
Yeah,
I'm
what do the partners be doing?
Oh, the
So,
partners.
well, I feel like partners go one way or the
Yeah.
other.
You
They
have-
either really good at support. Like some people, I'm looking at them thinking, "You picked a good man.
Yeah.
Like, well
Yeah,
done.
yeah.
Like well done, Cinema." And then there's some people I'm like, "How did we get
Yeah.
here?"
How did we
Because
get here?
you are in pain. That they're just so useless. They don't help it. The football ones, those one will
No.
annoy me every
I
single
thought that was just, like-
time. No, it happens, especially when
Yeah, it
Euros is
happens.
going on.
Yeah, or like
Really?
World
Oh my
Cup
God.
and all of that.
They're really just on
They're-
their phone.
they're
Some
literally
guys,
in the
phone is
corner.
like this. Yeah, baby. Yeah, babe. Yeah, baby. Yeah, babe.
And I know if it
No.
was me, I'd be ticked
You better
off.
concentrate.
Like, what? Yeah. But you do, I feel like partners are really good and they try. We've seen partners get
Yeah.
told off so many times and I'm just sitting there like, sorry.
Yeah.
like,
Yeah.
getting
I
the heat
think our
from it.
most trying time with the partners was during COVID and like off of the back end of COVID because we had so many restrictions in terms of partners. Because I remember at our trust, at the back end of COVID, they were only allowed once their partners were in active labour.
Okay.
And then like quite literally basically as soon as the baby's out, like you've got to go basically. So when they went onto the ward, they weren't allowed their partners, and we got so much whack for that.
Really?
Like I think that era was the time where I saw the most violent men.
Yeah, that
ever.
must have been hell.
And I kind of get it, but it was like
shouting, effing and blinding.
You should just let them come and get COVID. That's their business. No, but then the babies are so we
were obviously just like and obviously it wasn't our rules, like we had to, like, it was plastered all over our trust website, so it was like we had to follow the rules, or like we could actually get in trouble for it as well. So it's so difficult. But even off of the back, we get partners that we get crazy people.
We've literally had one together.
We had one together. We had
Did you work in the same hospital?
Yeah. So we had a guy one time, absolutely nasty man. He was absolutely violent, and I remember I'd come in and like the person that was already handover kind of already gave me like a sign that like, you're gonna have a bit of trouble with this one. So I thought, because I'm quite, Olivia will know, I'm quite like, I don't really care. Like, I don't take anything. Like, I don't really care. No one can really faze me. So when she told me, I was like, can't be that bad. Like, I'll just get on with it. And so I went in, and I remember I was getting the handover, and I remember like he kept like disrupting and kept saying, well, my wife's in pain and do you guys not doing anything? And I was like, look, give me a second. I don't know anything. I've just walked in. I can't help you if I don't know what's going on. I need to find out what's going on, what your wife's had, so I can help you. Anyway, so he's given me this handover, and from what had basically told me, it sounded like he was basically making all the decisions for her. So I thought, okay. So I think at this point her waters had been gone for about 2 days, and usually we administer antibiotics after 18 hours, and hers had been gone for about 40 something hours, and he was refusing for her to have any antibiotics, no epidural, no nothing.
You do it then.
Right.
So I was like, okay, fine, right, I know what I'm kind of handling with now, whatever. So then she's gone now, and at this point obviously we do this, we give the antibiotics because to reduce the risk of infection, and usually when there is an infection brewing inside, it shows up in mum first. So with temperature, high heart rate, she was showing all those signs already. So I was like, look, there's obviously an infection brewing, rethink the antibiotics sort of thing. Anyway, they ended up deciding that they wanted it, but quite frankly, we're like 48 hours gone. This infection has probably been brewing for God knows how long. By the time we actually get the medications in and get these medications into work, things are already going to be brewing and working. Anyway, so I'd already, because they had then accepted everything at once, and I think he just about allowed her to have an epidural at this point, but then didn't want her to have any top-ups, because you know how you have to keep topping up. So he didn't want her to have any top-ups of it. So I thought, well, anyway, I didn't know this. I just thought she has an epidural. So this lady's literally wincing in pain, and I'm like I'm looking at the system, because our system tells us the system tells us how many top-ups they've had. So I'm looking, I'm seeing, wait, this lady has had an epidural in for about 3 hours and she's not had one top-up. No wonder she's wincing. So me being the innocent midwife I'm like, oh, do you want a top-up? And he just went ballistic. What have I told you midwives about offering? Ballistic. I was literally like, okay. I literally said to him, I'm really sorry, but at this point, it's not about you. It's not appropriate for me to listen to you. So I then turn around and say to him, do you want a top up? Because quite literally, yeah. And when I did that, he was just going back. I was like, do you want a top up? And she was like, yeah. I was like, fine, click. And then she clicked it anyway. So because they had then accepted all the medication at once, so I had, because we give quite a few antibiotics at that point. So because I was trying to get everything in as quickly as possible, obviously go out the room and then ask for help. Because her heart rate was sky high, she needed an ECG and all this. So I get Olivia and I'm like, look, Olivia, come and help me. I've got this angry man. So I'm like giving her a warning. I'm like, this man's angry. But come in and just help me like do all this stuff anyway. So Olivia's then putting on the stickers for the ECG, because we've got to put like stickers everywhere. So then Olivia like goes towards the hand to put the sticker on, and then he like budges Olivia out the way and then gets an Apple Watch and starts putting it on. And
an Apple Watch?
Yes, because the Apple Watch is going to diagnose.
What?
I had
my
no idea.
God.
So Olivia was like, look, can you please not do that, because I'm trying to. And he's like, oh, you effing midwives, you lot ain't got no effing manners. I was like, oh,
some
my
people
goodness.
that are trying to help your wife and your
And I
child.
didn't say please on purpose.
Yeah, and I literally said, so me and Liv were just looking at each other. I was like, oh my god.
Yeah, we literally looked at each other and they looked and they said, carried on.
Insane.
What a
And he
nightmare.
effed and blinded me to the point where I stood up, I was like, look, you're not going to keep speaking to me like this. Like, I will literally just have security, have you. I'm not doing this. I don't care. Because sometimes when I do have violent partners, I then think, look, cool, this is the person that this woman has chosen it. I don't want them to go through labour and birth alone. If this is the person they chose, fine. But it got to a point where it's like, look, I am so sorry. I'm going to be a way better support to you than this man over here. So I was like, security, get this man out. Like, I was literally like, no. And he's like, you think you're going to kick me out? I'm going to leave myself. I was like,
oh,
doors
you sure
and there you go. The doors open.
Yeah.
But yeah, he was
piece of work.
What a nightmare.
Honestly, I remember he even tried to pick a fight with another dad.
He's the problem.
So he was just, I don't know what was going on.
He's the problem.
And I remember we safeguarded her so many times, and she was just like, no, he's just worried, like this is what he's just like, and I was like, look, this is not even normal.
Yeah, not at all. What
like
the hell?
you're in labour having a baby.
Just calm down.
Yeah. And that day I remember he was so rude to us, but the minute he saw male doctors, I was like,
one of those.
Say no more. Okay.
So I was like, no rudeness for the male doctors, fine.
Interesting. Funny
fine.
that,
and
isn't it?
We get that a lot. We, like, they look at us and just like, this midwife little girl don't know anything. And then as soon as they see the doctors come in, they're like, yeah. I'm literally like, people don't understand that we're actually the primary carers when you're in labour and birth. The doctors are just there if we need them. Everything passes through, but some people come in, especially I find in a lot of men, they come in and they're just like, hey, get a doctor here, like, we don't know what you're talking about. And I'm just like, absolutely crazy.
If only you knew.
I can only imagine.
Some people we have like cuckoo.
I bet.
To answer the question, I think I'm gonna say I've said this story before, but the funny story was my wig.
What happened with your wig, girl?
There was one time I was delivering. It was difficult delivery in terms of she was in pain, so she wasn't trying to push. So quite literally had to hold her legs apart so that she could push. Anyways, I felt like I delivered the baby that day. Like, we really fought for that delivery, and I was wearing a ginger wig. It was not glued down.
Oh, babe.
But I had a band on. I just, not the melt bands, just a normal headband, because the melt bands be hurting my ears sometimes.
Yeah, they can be tight.
So we've had this difficult delivery, you know, she's done now. We're like, oh yeah, congratulations, whatnot. I noticed that the dad's looking at me a bit funny, but didn't really think of it. You know, they've just had a baby. It was a tough delivery as well. So I've left the room, gone to just get something, and I just worked out my phone. My wig was here.
Oh my God.
My bright ginger wig was here. My cornrows, you couldn't even make out they were cornrows, was on shirt, and my headband was still here.
Oh my God.
I will never forget that day.
No, that's funny.
I think that is the funniest thing that's happened to me till this day.
I think my stories are more like crazy. Like, I remember I had this one girl, Nigerian girl. She was the funniest. But in labour, when I say I quite literally had to like cover the edge of the bed because she was rolling everywhere. She grabbed me like this. Grabbed me like that. She was literally like and to the point where, you know, like her husband was so stressed. Like, he had no idea what to do. He was literally like kept saying to me, I'm sorry. And he was literally just like, she was so quite literally uncontrollable. When there was no contraction, she'd be like,
yeah. Then
and I remember there was one point she was like, when there was no contraction, she was like, but she was saying to her, I want oxtail, babe, I want oxtail right now. And as soon as the contraction would come, she'd literally just lose it. Like, completely lose. She grabbed me. I left that room, my hair was sticking up. I was scruffed up. I was just like, I came out of the room and I was like, when that baby came out, I was like, I feel like I had a baby.
There's them deliveries where you feel like, you know what, I did
me
that.
Like, do you know how many times I've gone home with a sore hand because I've been gripped, I've been scratching, and then as soon as the baby comes out, they're like
completely different person.
Completely different people. It's
so
like
funny.
it's like meeting two different people.
Yeah.
Quite literally.
Oh my gosh. But yeah, like
that would be
yeah.
Oh,
okay.
God.
I have one more question for you. I mean, as a black woman in the NHS or the healthcare system, being obviously you've gone through your pregnancy, labour and birth here. What would you say, if you had to summarize what your kind of the care was like for you, what would you say was, not just as a pregnant woman, but as a black woman as well going through it? Do you feel like the concerns that you had, do you think they were heard, they were listened to? If they weren't, how do you think like we could improve on that or do better?
Yeah, that's a really good question. I personally feel like I had a very pleasant experience, but just because I did, it doesn't take away from what other people say that they go through. So I understand that I'm probably an anomaly in that sense, but I did have a very pleasant experience. That's so from my community midwives when I was going to my sort of antenatal appointments to when I actually was in labour, apart from that girl that tried to send me home with preeclampsia, honey. And she tried it. But other than that, it was very pleasant. Anytime I had a scan, is it sonographer? Yeah, they were lovely. I did some private, some NHS. I honestly, I can't complain. For me personally, I did have a very, very good experience. I would just say, just go in there ready to advocate for yourself is what I would say. Because as you were saying earlier, anything can happen. It's so unpredictable, these, you know, pregnancy and labour and delivery. You just never know what's going to happen. So just have someone in the room with you that isn't, you know, someone that isn't shy, someone that's going to speak up for you so that God forbid, if you do need to, then you can. But yeah, I mean, for me, I don't feel like I faced anything like that. I don't think that I experienced anything that flagged up to me because I was a black woman, really. It's just the usual NHS stuff, long waiting times, you know, waiting on the phone for hours sometimes, trying to get hold. Like I had a couple of situations where I felt like lack of movement with her, and I would always get paranoid and I would always go. Like if I felt paranoid, I would get up and I would just go get scanned and just to, you know, put my mind at rest. And yeah, sometimes we'd be waiting around for hours, but it's the NHS. It's just kind of like what you expect. So I didn't have any complaints. Like my midwives on the day were all amazing. Like everyone was so nice. You know, everyone spoke to me kindly. Everybody was very soft and gentle. Everybody was very available. I mean, I ended up discharging myself because I just wanted to go home because I had the preeclampsia, but once they took my blood pressure again and it had gone back to normal straight away, and I just felt ready. I felt fine. You know, I mean, apart from the stitches, which were out, so I tore down there. Other than that, I was absolutely fine and I was ready to go home. And, you know, I ended up having to discharge myself because I was like, I don't want to stay on the labour ward anymore. And the labour ward was more because of, I just wanted to be in my own environment,
your own space,
you know, and I just wanted to get on with motherhood. You know, I just wanted,
at home anyway,
exactly.
So.
I just didn't want to. And Anaya was a very good sleeper, good eater. So the other babies that were in distress, I felt like it was kind of like trickling down to us and just like messing with like my mind. So yeah, but other than that, I would say that my experience was very good. But at the same time, I understand that I'm, you know, I might be an anomaly, you know.
No, that's amazing. That's amazing to hear because like we said, part of our, you know, like message and what we stand for here is that we want to hear. I don't want to always talk to a black woman and hear bad experiences. I love the fact that you had, you know, I feel like sometimes we can get a little bit hell bent on just dying for a bad experience for a black woman, but no, we need to understand that yes, doesn't take away. We know that, you know, the statistics are literally proof that, you know, black women do have bad experiences, but it's so nice to hear that a black woman has had a good experience in maternity because we want to hear those stories. Those stories are also encouraging for people.
I agree.
Because I feel like something like we said, there is sometimes that dark aura around black maternity and that's what everyone looks towards when they're pregnant, and it's just, it creates anxiety. You know, sometimes I feel like it even stops black women from even enjoying their pregnancy because all they're thinking about is, oh my God, when I go to hospital, I'm not going to be listened to, I'm going to bump into this and this and that. But it's so good to hear that you had a positive experience. And I always do say, even apart from all the things like advocating for yourself and, you know, making sure that you're informed, is that it also depends on the people that you walk into as well. It depends on who's actually looking after you on that day. That's going to make your experience 100%. As well. So it's nice that I think it's amazing that you had great midwives, you felt listened to and you went in. And I love the fact that you said that when you felt like baby wasn't moving, you know, you went in. Like that's what we say all the time. Like we shouldn't feel ashamed. Like people should just go in whenever they feel like babies' movements are reduced and whenever they feel like anything's wrong. All
right. No, it's good to put positive stories out there. Everyone always, when something bad, we're quick to speak on it. When something good happens, everyone just enjoys it in private.
Talk about
it's good to kind of spread that awareness.
I totally agree.
But I think that's us. Again, thank you so much, Audrey, again for coming on the delivery room.
Thank you for what you do as well. Like, I think it's so important to see young Black midwives being in the space, because there's nothing like seeing someone that looks like you. There's nothing like it. And I think that it's amazing what you're doing and being visible. And that's why I feel like this podcast is important, because then people can see that it is an option. It is a career option. Definitely. You're needed, you're valued, you're appreciated. And thanks for having me, and well done on everything you do.
Thank you so much. Yes. So once again, guys, this is Audrey. Do you want to tell them where they can find you?
Yeah, so you can find me, well, if you listen to podcasts, you listen to my podcast, The Receipts. If you like reality TV, you can listen to my other podcast, The Recap. Follow my mummy page, Raising Me in Mine. I feel like this makes sense, Raising Me in Mine. You should come on my podcast as well, by the way. Raising Me in Mine, it's like a community-based, platform run by me and my friend Aisha. It's such a nice space. Like, the mums on there are amazing. Like, we do events and it's lovely. But follow me. Like, you can find me on Instagram, TikTok. I'm pretty much everywhere yapping.
Right. So thank you guys for tuning in again. Find us on TikTok, Instagram, and YouTube, The Delivery Room Podcast and The Delivery Room. Thank you for tuning in, and see you next time. Bye.